Today we'll talk on something which most of my female patients ask me this question. Doctor, why don't you suggest me hair transplant? I'm asking you to do my hair transplant and you are telling it's not needed. Why is that you tell that for females hair transplant is not needed? Let me explain you in the most simple way. See, why in females the hair transplant doesn't work? Because they have a generalized thinning. That means they lose more hair on the top portion of the head, but even the back and the side hair is also thinned out. That is the reason when you take out those thin hair follicles, it doesn't give you great result. So why hair transplant is so successful in men? Because they have this patterned alopecia, wherein even if they go completely bald on the top portion of the head, they have this side hair which is very strong. Usually men don't lose the side hair and the back hair. That is the reason hair transplant is very successful. So when we do, as a hair transplant surgeon, when we do hair transplant, out of 100 cases, 95% we do it for men. Only around 5% of the cases we do it for females. And the other reason why women are not good for transplant is because they have associated hormonal issues like thyroid issues, PCOD issues, and even nutritional issues like hemoglobin issues. They have comorbidities a lot. That is the reason they are not a good candidate for transplant. Then where do you do hair transplant in female patients? We typically do in those cases where they have good donor area and they have more of a localized hair fall, wherein only on the top, or if they want a hairline reconstruction, or if there is a scarring alopecia, or sometimes eyebrow reconstruction. In all these cases, we do female hair transplant. Hair transplant works excellent for men because they have patterned alopecia, and women, very few cases we take up because of the simple fact that they have generalized hair thinning, which doesn't give them volume. Because what woman is looking is for volume, because women, they never go bald like men. So even after doing hair transplant in my career, what I have seen is not many females are very happy with the results. To conclude, hair transplant works excellent for men, and for women, medications and medical therapies like PRP, GFC, mesotherapy, stem cell therapy, QR678 therapy. There are so many other therapies which help them to regain their lost hair. They usually don't need hair transplant.